Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental.
And I'm Evelyn Hallford of eCore Wellness in Encinitas.
And we wanted to talk a little bit about how we work together to get our patients healthy. It's pretty incredible how patients have no idea that the mouth can be the root cause of so many of their symptoms. I see a lot of patients that are seeking holistic care because they have heavy metals in their mouth or they have Lyme, mold. There's a lot of other issues, brain fog, gut issues, leaky gut that will manifest in the body, but they're actually starting in the mouth. So if someone comes to me, I can take out their heavy metals. I can take out their infected tooth or their hidden infections in their jawbone. But then there's a component of what happens next. How do we get the rest of it out of the tissues in the body? Because Lyme, mold, and metals can be significantly difficult to remove, and it can be a very lengthy process. So, Evelyn, how do you, after I finish some of the
Mhm.
metal removal or the infection, then get the patients healthy?
So that's really important because that's part of establishing what is the actual root cause. And, people don't realize that the oral cavity is a direct link to the esophagus, which is a direct track down to the gut.
Yes.
And so for us, some of the, not the challenges, what started, because everything that's in the gut can also go up to the esophagus. So for a part of what we do is when you send them to us is, with our functional testing and everything, what came first? But that's kind of interesting to us. But we know that the oral cavity has to be addressed, or that bacteria will keep on giving and keep on going to the gut. It will lodge there, and then it will help increase that leaky gut syndromes by weakening the gap junctions, and it will leak into the
Mhm.
circulatory system, and then it becomes systemic. And so once it becomes systemic, that's where we can really make a difference at our clinic because we do things like EBOO, extracorporeal blood oxygenation, and ozonation. Plus, we have several IV therapies to help pull those toxins out, filter
Mhm.
them from the bloodstream, help support the detox pathways, and just get rid of them once and for all. But if you can't get rid of, you have to find the root cause of them and then fix it. But usually this is connected to this. And so if you've got issues here, you've got issues here.
Yeah. Now, how does the ozonated blood recirculation EVO work on patients to get the toxins out?
Well, it does a lot of I swear, it's just ozone is just amazing, but EBOO actually has a filter on it, so we're filtering 3 to 5 liters of blood, and then as it's being returned to the body, it's being ozonated. So we recommend that patients do 4 to 6 of these a week apart, plus our IV protocol, and what's happening then is we're able to, do some other therapies to pull the toxins up into the bloodstream. They get filtered then during the EBOO session, but then the ozone's coming back in during the EB session, and we're able to ozonate 3 to 5 liters of blood, which is like the most powerful ozonation,
Mhm.
technique out there, which is antibacterial, antimicrobial, antifungal. And so then any of these things that we're talking about that are bad, I mean, we haven't gone into them in detail, but just know this: they don't like oxygen.
Yes.
They're anaerobic. So when you become oxygen rich through this process, there's also more die off occurring, which is really important after you've had an extraction or procedure. And it will get to the gums, it will get to the nasal passages, it will get up there.
Mhm.
So that's what's neat about eBoost because you don't have to do all these different forms of ozone. It's like a one shop that's taking care of all of it.
No, I went to you for the EBOO
Mhm,
after, as you know, I was heavy metal toxic,
mhm.
and it's something I have to really stay on top of. After I did my detox, it's because I'm around it all the time.
Yeah.
It's something that can really build up for me. And I also think I'm very sensitive to plastics, microplastics, and whatnot. Actually, all of us are.
Mhm,
So that was one of the things that we were filtering when we did the
mhm.
EBOO.
You should definitely do it a few times a year. I would recommend
Hmm.
for you that you do it like seasonally, do 2 or, do at least twice a year, do 2 back to back, do 4 year annually. But once you do our detox protocol, I think everyone just needs to it's the environment we're living in. As
Yeah.
much as we try to protect ourselves from forever chemicals, microplastics, heavy metals, and then all the pesticides, as good as we try to wash everything in baking soda and water, sunlight, buy organic, that's still all making it into our gut.
Hmm.
And you just remember that, that the ozone, that's what's so great about the ozone is that it can kill all those bacterias. But then you have to rely on your own detox pathways if you don't do something like EBOO. So even if you don't want to do EBOO, We do other ozone therapies like MAH and things like that, but we have to make sure that we need to test, we need to run labs, we need to make sure that your drainage pathways are open
Mhm.
and that you can detox everything effectively, or else everything's not working. It won't work like we want it to.
Mhm.